One of the biggest controversies in the United States today is that of healthcare. We spend over $2.3 trillion on healthcare, yet we see over 48,000 preventable deaths a year. About 25% of senior citizens declare bankruptcy because of medical-related expenses. On top of that, the political gridlock has made any shot of reform impossible. There are many events that have led up to this current condition, and it is important as American citizens to understand the history behind the debate so we can draw informed views on the argument.
The issue of healthcare in the United States has been a salient issue as early as a few years prior to the Civil War. In 1854, Dorothea Dix proposes her bill for the benefit of the indigent insane. This was passed in both the House and the Senate before being vetoed by President Franklin Pierce under the idea that federal government should not commit itself to social welfare. This was the job of the states. Now, as we move into the 20th century, we see the first proponents of universal coverage. In 1912, Theodore Roosevelt would run for the presidency with progressive health reforms on his platform. Alas, he was defeated by Wilson. The American Medical Association was opposed to the idea. Because some people already had health insurance through their employers, public support for the idea was low. Another viable reason for his lack of support would be the tradition of classical liberalism and limited government in the United States. The big move wouldn't be until FDR tried to have public health care bundled with Social Security in 1933. As before, the AMA opposed the act vigorously, and FDR would take it out of his bill in 1935. In 1949, Truman wanted to draw up a single-payer system to include in his fare deal. The AMA rejects this once again and drums up huge public support against it. Change finally occurred in the 60s. People began to fear not being insured when they were retired and grew elderly. Lyndon B. Johnson had signed a bill that would offer Medicare and Medicaid to those who qualified. Because Medicare would help everyone out as they grew older, many supported it. However, the AMA opposed it on the grounds that Medicare and Medicaid are compulsory, socialized medicine that reduces the quality of care received. In 1985, COBRA would make it possible for someone to keep their employer coverage after retirement. In the same year, the Emergency Medical Treatment and Active Labor Act was passed, disallowing hospitals from refusing emergency medical treatment. In 1993, Hillary Clinton pushed the country towards passing a National Healthcare Act. The following year, she took a bus tour across the United States, meeting with different people who shared her opinions for reforming healthcare. The 1993 Clinton Healthcare Act would not be passed due to attacks from conservatives, libertarians, and HMOs alike. They questioned if an American healthcare crisis existed at all. Perhaps times were better in 1993, but there's certainly a healthcare crisis going on now. Despite being highly advanced and one of the most powerful nations on the planet, America's healthcare record is ghastly compared to similar advanced liberal democracies. The United States manages to spend the most on healthcare per capita and as a percentage of GDP out of every nation, double the next highest spending country, and yet quality of care is ranked last among similarly industrialized nations, according to the Commonwealth Fund. Meanwhile, the U.S. Census Bureau reports that 16.3% of the population, or around 50 million people, were uninsured as of 2010, the date of the last census, and this does not include those who are underinsured and do not possess health insurance covering some basic and necessary procedures. In total, this lack of insurance and huge price tag has led to a great deal of unnecessary deaths at upwards of 48,000 a year, and a great many more bankruptcies. In fact, 61% of those who declared bankruptcy in 2007 cited high medical expenses as a large factor in their decision. All in all, America's shamble of a healthcare system has left the U.S. with a very high prevalence of infant mortality, teenage pregnancies, disability, and many, many more maladies, and a land of plenty. So why has this all come to be? What systemic problems plague the nation and its healthcare system? Well, an in-depth economic and political analysis would be necessary to see them all. There are some glaring troubles that need solving. Perhaps the most obvious problem is that of administrative costs, which account for 31% of all healthcare costs in the nation. Medicare, the public healthcare option for senior citizens, boasts administrative costs of 2%, and other nations similar to the US, such as European nations, also possess such reasonable numbers. Hospital charge masters are another huge price inflator in the system. They are the listed price of every procedure or item billable to the patient or his insurance company, and are usually outlandish figures many times the cost of the hospital. Reporter Stephen Brill wrote in Time magazine that charge masters list prices that are devoid of any calculation related to cost. A low supply of doctors also contributes to the high cost of care, as the number of physicians that can be trained per year has been stable at 100,000 since 1910, in a regulation lobbied for by the American Medical Association. American health habits are not a health either, and obesity and the chronic illnesses perpetuated by it burden the healthcare system unnecessarily. These and countless other tribulations make the American healthcare system what it is today. While the problems with America's healthcare system may be difficult to ascertain, the solutions to these problems are even more difficult. Better yet, the topic is an enormous public controversy, with liberals, conservatives, and every ideology between or outside having their own solution to the crisis. The American public is split on their conceptions of healthcare and cannot decide on issues of cost-effectiveness, accessibility, and freedom of choice. Usually, those on the far left favor more government interference in the healthcare system, leaning towards a single-payer system, and those on the far right fear such government intervention and the prospects of a paralyzed healthcare bureaucracy, leaning towards free market solutions. Meanwhile, the public is left with Obamacare, a law that most do not even comprehend, let alone like. We believe it is important that the American public remains informed about an issue so pressing as healthcare, and as such, we would like to present the workings and understandings of Obamacare, and then present alternatives from the left and right. We hope that by doing this, Americans are better able to make such important decisions about the way the country should turn. Obviously, we cannot stay where we are now. A single-payer system describes a funding structure where the government pays for all healthcare services. Due to its government-funded nature, it tends to promote universal coverage of the public, regardless of pre-existing conditions or ability to pay. An optimal single-payer system features no out-of-pocket payments for healthcare, also known as cost-sharing, a free choice of providers, public accountability, and a lack of lifetime limits to care. Proponents of a single-payer system argue that a single-payer system would not only increase coverage of the population, but also lower costs by limiting administrative fees, all the while increasing quality of care by the formation of a national healthcare database. According to a study by the Harvard Medical School and the Canadian Institute for Health Information, current administrative fees are at 31% of all health costs, compared to 2% for the Medicare program, which is an already existing single-payer structure. By extending the Medicare program, or a similar single-payer system, to all citizens, as the Congressional Budget Office notes, all residents might be covered by health insurance for roughly the current level of spending or even somewhat less, because of savings in administrative costs and lower payment rates for services used by the privately insured. Thus, the goal of relieving economic strain and serving a moral obligation to the public could be achieved simultaneously. Vermont has already taken up this initiative and has become the first state in the Union to institute a single-payer system called Green Mountain Care, which will be implemented by 2017. It will be interesting to see the results, as the direction of the nation rests upon its success or failure. Additional arguments include removing the strain of healthcare coverage from employers and the idea of expanding healthcare leading to an increase of productivity. Opponents of a single-payer system insist that government-run healthcare would be inefficient, bureaucratic, corrupt, and prohibitively expensive. But can it be any worse than our current system?
In opposition to the single-payer system and Obamacare, the libertarian proposition is to establish medical savings accounts, deregulate the healthcare industry, and to remove barriers to safe, affordable medicines. They argue that the safe and affordable healthcare system of the 1960s was hampered by government intervention through Medicare, Medicaid, the Health Maintenance Organization Act, and increased regulations on doctors, hospitals, and health insurance companies. As a result, over 50% of all healthcare dollars are being covered by government spending. In order to counter this, it is necessary for the healthcare reforms to draw on the free market. The first of these reforms, being the medical savings accounts, would allow people to deposit money into an MSA and withdraw when needed. Those without an MSA will make healthcare expenditures 100% tax deductible. The next of the three reforms is to deregulate the healthcare industry by removing policies that increase health costs. These laws mandate coverage, reduce consumer choice, and increase costs. An increased cost will result in more uninsured Americans. The last of the reforms is the removal of barriers to safe medicines. For example, removing the FDA, with a free market alternative will drive costs down by eliminating bureaucratic roadblocks to important medicines.
The Patient Protection and Affordable Care Act was signed into law by President Barack Obama on March 23, 2010. It represents the most significant and controversial overhaul of the U.S. healthcare system since the passage of Medicare and Medicaid in 1965. The Affordable Care Act was created with the goals of increasing the quality and affordability of health insurance, lowering the uninsured rate by expanding public and private insurance coverage, and reducing the cost of healthcare for citizens and the government. It introduced a number of mandates, subsidies, and insurance exchanges that were meant to increase coverage and affordability. The two main mechanisms for increasing healthcare coverage include expanding Medicaid eligibility to more citizens and creating state-based insurance exchanges in which small businesses and individuals can purchase healthcare. Individuals with considerably lower incomes than the average citizen are also eligible for subsidies offered by the government to buy healthcare.
There are many conflicting views on the Affordable Care Act. Many Americans, 32% according to nationaljournal.com, are in favor of repealing the act entirely. There seems to be a few misconceptions about Obamacare amongst the citizens of the United States. Prevalence of false information about Obamacare and the unfavorable conservative bias towards the act has influenced many citizens to adopt similar viewpoints on Obamacare. Recently, on a popular late-night show hosted by Jimmy Kimmel, this fact was proven when his TV crew took to the streets and asked citizens if they preferred the Affordable Health Care Act over Obamacare. In actuality, these two terms mean the same thing, but this didn't stop people from giving their uninformed 2 cents on the issue. Since the ruling, the law continues to face challenges in Congress and federal courts, state governments, conservative advocacy groups, and small businesses and organizations to this day.
Having explored the history of healthcare and the arguments of the single-payer system, the free market solution, and Obamacare, we hope you can draw more informed decisions regarding a major hot topic in Washington today.
Yash Tripathi is my best friend.